Hello, everyone, and welcome to our weekly COVID-19 community conversation. Before we get started, I'd like to go over a few things so you know how to participate in today's event. If you're listening in on your computer speaker system and would prefer to join over the phone, just select telephone in the audio pane, and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. And now it's my pleasure to introduce our speakers. First, OMS President and CEO, Dr. Mohan Santa. Second, OMS Incident Commander, Dr. David Marcosi. Dr. Santa and Marcosi will be addressing several topics of importance to our communities today. The first, caring for our patients. The second, caring for our community. And the third, caring for each other. At this point, it's my pleasure to introduce Dr. Mohan Santa.
So thank you, Chris, and on behalf of our entire health system, I want to send a very clear message to everybody who is listening to this webinar, and that is a debt of gratitude. Because I think collectively, we as a community have come together, and the efforts that are being put forth by members of our community to flatten the curve are critical to our healthcare mission, and so we are incredibly grateful. We at the medical system are wanting to recognize the incredible efforts of our workforce. We believe ourselves to be the home of truly brave individuals who have answered the call in a very meaningful way, and that there's no question that it is our view that as Marylanders, we are all in this together. We want our communities to turn to us as trusted partners in care, and as a consequence of that, we have launched a public health campaign called We Are In It Together, and that you'll see the news media and online coverage encouraging our community to keep up the best practices, such as good hand washing practices and social distancing, because collectively that is our responsibility. And if we do it together, we will continue to have the impact that we are starting to see in terms of trying to flatten this curve. In terms of our status update, when you look at the United States, we have over 670,000 citizens who have been diagnosed with COVID-19 across the U.S. Here in Maryland, we have over 11,500 Marylanders who have been diagnosed with COVID-19. And today, within the medical system, across all of our member organizations, we have 42 patients who are under investigation, and we have 253 patients who have tested positive for COVID-19 and are currently receiving care within our organization. We know that this virus has spread significantly throughout the state, but we also know that the action that we have taken together as a state has helped flatten this curve, and that now we as Maryland can now strategically utilize resources to focus on the areas within the state where we are seeing the hot spots emerge, and where we can also focus our resources on vulnerable populations within our communities to make sure that we do our level best to minimize the spread of this disease. Now, some of our hospitals are already seeing a surge of patients, but like we have seen throughout the country, it is not evenly distributed throughout our system. Our health system is 13 acute healthcare facilities that geographically is spread throughout the state. And we see that we are experiencing the surge at different levels across our organization. Our health system and across our hospitals, we need the capacity to treat patients in need of critical care. And so instituting policies to clear space, decreasing the possibility of community transmission, is the way we keep our hospitals safe. So we have strict patient safety policies. Routine appointments and elective surgeries have been postponed indefinitely as a way, again, of keeping our community safe, keeping our healthcare workforce safe, we have launched an expansion of our healthcare services that are telehealth services. And they allow our patients to interact directly with healthcare providers from home. We have needed to move patients who are now in the convalescence phase of their care outside the walls of our acute care facilities, and we've done so in a strategy in partnership with Johns Hopkins and the state of Maryland to stand up the state's first field hospital at the Federal Medical Station at the Baltimore Convention Center. And again, this is a facility that will allow patients who are convalescing from the acute care setting to be moved to this setting to allow their continued healing process.
Thank you, Dr. Santa. We'll now move to our second topic, which is caring for our community, and it's my pleasure to introduce Dr. Mark Oden.
Thanks, Chris. Thank Dr. Santa. Honored again to speak to you all as we move through this crisis together. A couple of things I'm going to be touching on is how do we keep ourselves and our families protected from this virus. So some of the things you've heard before, you'll hear me say again, but maybe with some greater facts as we continue to kind of uncover the science behind this virus. Fortunately, most folks who are contracting this virus experience mild symptoms, fevers, cough, some mild shortness of breath, perhaps a sore throat. And in fact, the CDC director recently said that as many as up to 25% of the people who with COVID-19 may be actually asymptomatic. In other words, have no symptoms at all. One of the things we need to be concerned about, though, is that people who are asymptomatic, they may, and who are carriers of this virus, may still spread this virus. And that's an important point as we start to think about what the next weeks to months look like as our communities respond to this event. Important to note that if you're having mild symptoms, as I discussed, you don't necessarily need to come to the hospital unless you're truly having an emergency. An idea would be then to call your healthcare provider, your primary care physician, or the free 24-hour, 7-day-a-week nurse call line, which I'll walk you through shortly. But calling them first for some guidance on how to manage your symptoms would be optimal. And then obviously if you're having an emergency, getting to an emergency department or calling 911 would be the next thing to do. Next slide. That nurse call line, if you've called in and you haven't logged into your phone number, or logged into your computer, I'll say it. The phone number is 888-713-0711. Again, 888-713-0711. And you can call that nurse call triage line anytime, day or night. It's a free service and staffed by registered nurses that can give you some guidance on how to manage your symptoms or answer any questions. If you have access to a computer, go into the CDC website, which has a coronavirus self-checker, which looks at your symptoms and helps you figure out what the next steps might be to manage your symptoms. That CDC website's a valuable resource. And then lastly, you can go to ums.org/COVID, COVID. Again, ums.org/COVID for some additional information that we have on our University of Maryland Medical System website to allow you to have some more information on COVID. Next slide. I've spoken about this before, but certainly I'll say it again. The fundamental for decreasing the spread of this virus is all around personal hygiene, and it starts with hand hygiene. And hand hygiene, just as my 5-year-old said, singing the alphabet or washing for 20 seconds is fundamental. You can't consider washing your hands for only, putting some soap on, washing your hands for 5 to 10 seconds. It takes, the studies show, 20 seconds to effectively wash your hands. And if you have hand sanitizer, that's another option for you. But soap and water for 20 seconds can be can decrease the spread of this virus. Next slide. Another key piece is making sure you physically distance. And if you physically distance more than 6 feet, it decreases the spread of this virus that is transmitted by speaking, by coughing, by sneezing. So if you avoid close contact, particularly with those who are ill, you'll decrease the spread of this virus, which is important. And practicing physical distancing about 6 feet will help us decrease the transmission of this virus. Next slide. Covering our mouth with our elbows or with a tissue and holding that tissue and throwing it away after you sneeze and cough, making sure you wash your hands thereafter, and avoid touching your eyes and nose and mouth. Those are all important things to make sure you decrease the virus transmission, which is essential to decreasing the increased illness to this virus as we move through the next weeks to months without any effective vaccine, which is kind of where we are right now. Next slide. Governor Hogan signed an executive order requiring face masks, and we're very supportive of that move. And it decreases the ability of this virus to be transmitted between people. And that's key. Just as washing our hands, just as covering our mouth are all fundamentals for an individual. You know what? Now, making sure we're wearing face masks is just as important. And covering your face with a face mask while riding in public transportation or inside any retail establishment or grocery store is going to be key. And that starts tomorrow morning at 7 a.m., Saturday, tomorrow morning, April 18th, 7 a.m. Everyone who's inside any retail establishment or grocery store or public transportation needs to be wearing a face mask. This is in line with the CDC's recommendation that everyone wears a homemade face mask. And I want to just make sure that if we are going out in public, Governor Hogan also provided us a stay-at-home order. We should only be leaving our homes. This doesn't replace that order. We're only leaving our homes for essential purposes. But when we do, we need to make sure we're wearing a face mask. You can make a cloth face mask at home using a bandana, an old T-shirt, and you can find instructions on how to do that at that ums.org/COVID website. We want to also make sure that, next slide, please. We want to also make sure that we're disinfecting all these high-touch areas. So if I cough and I cover my mouth with my hand incorrectly and don't wash my hands, and then I touch a doorknob or a light switch or a handrail, and then if someone who's not infected touches it and then touches their mouth, nose, or face in any way, you have the potential to contract this virus. And that's what we have to stop by washing our hands. That's what we have to stop by having a face mask on. And if we're keeping these areas of high touch clean and disinfecting them, this virus will be transmitted less between us, and that's the key. Next slide. So when we're grocery shopping, as we saw, the governor came out with the idea, it's a good one, around mandating face masks in grocery stores. And when we need to get groceries from a grocery store, we should think about, if it's an option, shopping online or potentially using curbside pickup to pick up your groceries to minimize the chance of being infected inside grocery stores. In addition, this is not the time to just kind of walk around and kind of look around. And you need to get in there, get what you need, and then get out of the grocery store to decrease your potential transmission from you to anyone else or from anyone else to you. When you're using shopping carts, make sure you wipe down the shopping cart, because anytime you, just like a high-touch area, a shopping cart has a lot of people using it, and they may be spreading this virus. So make sure you're disinfecting that shopping cart before you use it. And then take advantage. If you're any of our senior population or high-risk population, take advantage of those dedicated days when you can go to the grocery store or shopping or times that grocery store may be open specifically for you, so it's a lower volume time and you can get in there and get out without having potential additional exposure. Next slide. So then you get home from the grocery store. Now what do? Make sure you bring one bag at a time into your home, wipe it down. There's a potential for those bags to be have the virus on them. Sanitize them with some cleaning wipes or cleaning supplies before not only the bag, but any of the things you purchased before putting them away. Make sure you're disinfecting those things that you just purchased. This virus can live on things for hours or days, depending upon if it's plastic or cardboard. So it sticks around. So we need to make sure that we are wiping things down before we bring them into our house and putting them into our cupboards. Next slide. And then obviously, go to the last slide. And then obviously, after you do that, you need to wash your hands, as I talked about. All right, next slide. So there's an opportunity for all UMS hospitals are involved in initiatives to address food insecurities during this crisis. And UMMC and other hospitals across our nation, across our system, are soon will be providing 40,000 meals to children and families in communities we serve over the past few weeks and in the future. And while we're doing it, we're modeling best practices around physical distancing. Hungry Harvest is our longtime partner and provides free fresh produce and distributes it weekly. Mount Washington Pediatric Hospital has provided twice weekly Hungry Harvest bowls that feed up to 4 people for as much as 4 days, and they've been doing it for 150 families over the course of the last few weeks. Next slide. During this time, we all feel a degree of anxiety. It's expected, and we need to think about how to address it. And you should visit some trusted sites or resources for information. We actually have some of them listed in the UMS COVID website, that ums.org/COVID website that I spoke to you about before. I need to think about how to be prepared. Create contact lists of important phone numbers and community resources with folks you can reach out to. This is about physical distancing, but it's not really about social distancing. And you can stay connected with friends and family through social apps, phone calls, and make sure you stay connected, because during this time of this crisis, we all now need to pull together more than ever through other means than necessarily being, face-to-face to allow us to stay connected. And make sure you're keeping track of your own health. Make sure you take your medications as regularly prescribed. Make sure you get refills on those medications. Get plenty of sleep. Keep staying active, so you get out of your house to make sure that you can make sure that you're going to be staying healthy over the course of the next few weeks. Next slide. Some of those mental health services are here and listed, and there's some upcoming webinars we all are struggling from this, and our children are struggling from this, and helping children cope. April 21st at 3 p.m. there's a webinar about helping children cope, and then April 23rd at 3 p.m. there's when we're isolated, how do we stay connected? And there's a website for ums.org/notallwounds. That's all one word, not all wounds, NOTALLWONDS. Go to that website for some of those webinars so we can better stay connected and better support our communities and our children as we all work through this crisis. Next slide. We have a whole list of phone numbers and websites and areas you can text and talk to folks, and 211 as a resource for our community and the Maryland Network Against Domestic Violence. We want to make sure that we are all supporting each other and ourselves as we collectively navigate this crisis. And obviously, if you're having concerns around depression or suicide, there's the National Suicide Prevention Lifeline listed there, 1-800-273-8255, that you should make a phone call to so you can get the right help if you need it. Next slide. Finally, the state of Maryland has a free opt-in telephone service that's great to check in on seniors age 65 and older. After you register, you'll receive a phone call every day during a pre-selected time block. If a participant doesn't answer on the first call, they'll be tried a few more times. If these calls go unanswered, additional calls will be made to notify an alternative person who you select when you enroll. Please register for this. If you're over 65, it's a great resource for Maryland to support Maryland through this crisis. And that phone number is 1-866-502-0560. Again, 866-502-0560. Dr. Santa, I think I'll turn it over to you and Chris Lindsley.
Thank you, Dr. Mark Oden. Introducing now our third topic, which is caring for each other, and handing it back to Dr. Santa.
Thanks, Chris. And during this difficult time for our state and our nation, I've been so heartened and impressed by how much our communities have come forward to help our medical system workforce and our patients. The sacrifices that all of you are making are absolutely helping our staff on the front lines. By staying home, you're preventing the spread of COVID-19, and we are seeing the impact in terms of flattening the curve, and we're seeing the impact of alleviating the burden of a surge on our healthcare staff. There's no question that this is an incredibly challenging time for our workforce, but it is also there's no question that our staff is encouraged by the level of support that they receive from our community. You may have seen the medical system and the university buildings lit up in red and blue in honor of all of our frontline staff, and we saw this in partnership with, in downtown Baltimore, the Ravens Stadium, the Orioles Park, all showing a signal in unison. And this signal was seen actually across the state, beyond the city of Baltimore, across the state of Maryland, and the workforce of our health system was absolutely motivated and encouraged by this, and we want to thank you for that. We also want to thank all the local businesses and the individuals who have donated food to our frontline providers. We've been inundated, in fact, with requests from people who want to know how else they can help support our providers on the front line. Many have asked specifically about how they can help create cloth masks. Use the guides and videos found at ums.org/masks to construct and sew cloth masks. Package the masks up in plastic bags and drop them off at the registration desk at any of our hospitals, where they will be inspected and then distributed to our staff as needed. And thank you to everybody who has donated already. Again, I will tell you that it's across our organization, the staff are very proud when they are wearing masks that have been made from our community members, and they're very happy to point that out.
Thank you, Dr. Santa. We're now going to answer some of your questions that you submitted from last week's webinar. But first, just a quick reminder that you can ask your questions now during this webinar, so please do that if you get a chance, and if you have one. First question is for Dr. Santa. If I'm seriously injured, can I still go to the emergency room?
So the answer to this question is absolutely yes, and it actually speaks to a much larger issue, and that is it's important for our communities to know that if you are in urgent healthcare circumstance, you need to be in a hospital. You need to get to us. We are absolutely able to care for patients who have urgent healthcare issues that are non-COVID related. It is a concern to all of us in the healthcare industry that our communities understand that if you are having signs and symptoms of urgent healthcare issues, you need to be able to get to our healthcare organization for appropriate care. So if you're having chest pain, you do not ignore it. If you are having symptoms that might suggest early signs of a stroke or anything that significant, we want you in our organization, whether it is the medical system or any other healthcare organization. We are all here to provide healthcare to our communities, and while there is obviously a disproportionate focus appropriately on caring for patients who are concerned about presenting with COVID symptoms, we want to make sure that everybody is understanding that we are here for any medical emergency. Please call 911 or come to our emergency departments within the system or any healthcare organization.
Thank you, Dr. Santa. Next question is for Dr. Marcosi. How do I get tested for COVID-19?
Thanks, Chris. Healthcare providers and state officials are working hard to provide Marylanders with more access to COVID-19 testing. But at this point, the testing is being prioritized for those who have symptoms. You must get a doctor's order to get a test. If you don't have a primary care doctor, please call our nurse call line at 1-888-713-0711, and you can get some recommendations on that. If you're having mild symptoms, stay home, contact your doctor, monitor your health, and take steps to protect the rest of your household. But if you're having severe symptoms, as Dr. Santa said, such as difficulty breathing or chest pain, don't waste time trying to get a test. Call 911 or go to the nearest emergency room.
Thank you, Dr. Marcosi. Next question is for Dr. Santa. What should we expect for the future? I heard that we may need to social distance until 2022.
It's everyone's goal to flatten the curve, and there are indications when we look at hospitalization rates across the state that they are in fact starting to stabilize. We're already looking ahead to what the future looks like for our state and our health system, and we are, like all, following the lead of public health and elected officials such as Governor Hogan. Governor Hogan said earlier this week that the state is now in a position to move from containment and mitigation to the rollout of a recovery phase. Now, this does not mean that the end of the healthcare crisis is upon us, and recovery will have to be done responsibly and carefully, and will have to demonstrate the same focus and effort that we demonstrated as we turned on the practices of social distancing. Scientists and caregivers and clinicians are actively working on vaccines development, including our colleagues here at the University of Maryland, Baltimore, and within the University of Maryland School of Medicine. We will continue to look for the advancement of science to help us figure out the path forward as we roll out the recovery phase. But we will also be dependent on good hygiene, positive hand-washing habits, and as Dr. Marcosi described, the focus on coughing and sneezing etiquette and handshaking etiquette in the new reality that we are facing as we come to the other side of the surge.
Thank you, Dr. Santa. Next question is for Dr. Marcosi. This is the last question we have time for. How long does the virus live on different surfaces?
Yeah, this is the reasons why we all need to keep our hands clean, and this is the reason why we need to continue to wash those high-touch surfaces. And the main reason is because this virus sticks around. It can last up to 24 hours on cardboard. It can last a few days on plastic and stainless steel. So that means that if I have the virus and it's on my hand and I touch any of those things, it could stick around for a few days. So cleaning things, continue to clean things, continue to keep your hands clean are fundamentals so we don't spread this virus. Chris, back to you.
Thank you, Dr. Marcosi, and thanks to both you and Dr. Santa, and thank you to everyone for joining us today. As a follow-up to today's webinar, within 48 to 72 hours, you will receive a link to the recording of today's session, and we will also post a link on our public website with the answers to your questions. So on behalf of Dr. Santa and Marcosi, thanks for joining us today, and have a great weekend.